Welcome back. The U.S. FDA announced that e-cigarette company Juul must stop selling all Juul devices and products from U.S. markets. According to the FDA, this was an effort to protect public health. Dr. Andy Hyland and Dr. Sara Siddiqui of New York State Smokers Quitline joined me to discuss the ban on Juul and the effect the e-cigarette has on teens in America. Thank you both so much for joining me.
Thank you for having us.
Now, Dr. Hyland, can you explain what e-cigarettes are and what the act of vaping is?
Sure. So e-cigarettes, the thing that makes them different than conventional smoking is that they don't burn tobacco. A battery heats up a liquid, and that turns the nicotine and some other things into a gas, and that's what you breathe in. So it's that nicotine goes to the lungs through that process. Cigarettes burn and create lots of chemicals in doing that, and that's where most of the health risks come from. That's why we know cigarettes are so dangerous. It's really that burning process.
And is vaping basically the use of an e-cigarette?
Yes, yeah, vaping is e-cigarette users, vapors, they're synonymous. There are different terms that are used, but Juul, vaping, e-cigarettes in the colloquial terms are interchangeable by many.
Got it. And now, Dr. Sadiki, do you feel that this is a win for public health, the banning of Juul products?
I mean, I think that it is a message to children that perhaps Juul and vaping is not considered, even though it may be considered safer than smoking combustible cigarettes, it may not be safe. And although the data is still not there, we do encourage that children not start vaping, and that's why it is a win for public health.
Now, they're only banning the brand Juul. Will this make other less popular brands more popular, or do you see an increase in their sales?
Children,
Well,
I mean, we're talking about children and vaping also, and we are concerned that just because Juul has been removed or being suggested to be removed, this will impact and will increase other forms of flavored vaping, especially towards the kids.
Now, Dr. Hyland, how does an e-cigarette differ from a regular cigarette?
Yeah, so those e-cigarettes, they use a battery, they heat up that vapor, and it's that vaporized nicotine that the user gets. So e-cigarettes are also characterized by their flavors and the different device types. Cigarettes are sort of like, they're all kind of the same, in a very broad sense. And they've been that way for a long time. But the vaping products today are evolving. The packaging is different. You saw those, the USB device type thing. The one thing that makes Juul that maybe best known for is that they figured out the chemistry better than the other companies. The way their product chemistry has really changed the way these products are, and they deliver nicotine more effectively. And some people argue that was the reason why the youth vaping increased at the time that it did, because of a better product, a better nicotine delivery system, which for kids is a bad idea. Nobody thinks kids vaping or using any nicotine product is a good idea. But for adult cigarette smokers, it's a more complex argument that's there, which we can touch on.
And to follow that, are they just as addictive as regular cigarettes?
Yeah, so it's the nicotine is the addictive substance that's there, and what we're seeing now in the most recent years is that the fraction of kids that are vaping are hooked. Increasing number of them. So, kids vaping daily 5 years ago didn't happen, whereas today it's approaching 40 to 50% of kids that are vaping every day, which is really dramatic, and I think speak to the issue of addiction. Is addiction itself a health risk? Even if the product itself may have less toxins than cigarettes, it's still not as clean as clean air, and that addiction brings people back to continual use of those products. And with young people, we just don't know what the future holds for them.
Now, Dr.
And I think it's
Siddiqui,
important,
mhm,
yeah, I
you can
think it's really
continue.
important to also remember that children's brains are developing still continuously until about 21 or 25. And so starting these habits, something that can be so addictive, it can be just much harder to quit later on. And these kids don't realize that it's going to be addicting when they start something like this. And so the nicotine, just as Dr. Hyland said, the nicotine is so much faster absorbed and faster getting to the brain, and it's much quicker addiction potential. And unfortunately, the kids don't realize that that's what's happening until they're well in it, and it's very unfortunate for them. And as being part of the Quitline, that's what we see, and that's what we're helping with, because it's an addiction.
So we're seeing
Hard.
a lot of these like negative consequences. Why do you think the FDA has ignored Juul and the rise of e-cigarettes for so long?
Well, I can speak to that. The news today or recently about Juul is really a part of a long ongoing process where all vaping products had to essentially apply to be allowed to be continued to be sold. They received 6 million product applications, and the FDA has already acted on almost all of them, millions of them, and some of the earlier Juul products, some of the flavored Juul products have already been denied. So of those millions of applications, any of the flavored products have been denied. It's really the products that have made it through. There's only about 20 of them, and they're tobacco flavored sorts of products, products that are thought to have low appeal to young people, but still to make them available to adult cigarette smokers that might be looking for an alternative that's there. So most recently, Juul had their tobacco and menthol mint product applications come up for review, and those were denied based on some questions about, I guess, the toxicology data. I haven't seen the reports, but that's what the press materials suggest, that there was some concerns or some conflicting information about some of the toxicology information. So it really is part of a long ongoing process, which is made complicated because of the way the FDA has acquired regulatory authority over tobacco products. Even if you think about FDA, they regulate drugs and drug delivery devices, a safe and effective standard, like our vaccines that we have for COVID. But when it comes to tobacco products, it's a whole different standard. Safe and effective don't really make sense there. So it's part of that long ongoing process over about the last 10 years that the FDA has acquired the regulatory authority and are beginning to implement some of it.
Now, why?
And I just like to add, I just wanted to add that the FDA, I don't know if the FDA really ignored as much as they weren't involved, as Dr. Hyland said, in the regulatory process. And then it became much bigger than we all thought it would. So I think that was the issue.
Now, I think a question many people find themselves asking is, why has this form of smoking just become so popular amongst young people and teens? And doctor, can you just tell me why you think that may have happened?
I mean, we have, if I deal with adolescents all the time, they're a great group of kids. This is the age group. I like all ages, but the toddlers and adolescents are my favorites. And that's because their frontal part of the brain is not developed yet. They're going to try new things. They're going to try different things. And if you say no to them enough, they might even, want to try it even more. And I think one of the reasons why vaping became so prevalent in the teens is because, and Juul marketed it or tried to kind of make it like glorious, kind of, they made it colorful, they made the flavors very wonderful sounding, and it kind of fit in the palm of your hand, and you could do it anywhere, and we didn't really know that it was bad for you at that time when it first came out. So it was easy to get, it looked good, it was, thought of as safe, which now we know that it just because it's safer, it's not safe. But that's, I think, the initial part of it, and then it kind of just, exploded from there.
Now, you mentioned like safer does not mean safe. Is there a safe option for smoking? Like, I know everyone's always looking for that, but does it exist?
No.
So I think being on the Quitline, right? Being on the Quitline, we know that the best thing is to not smoke and not vape, but we do understand that it's addicting, and that's why we're developed such a supportive atmosphere that we know that it's hard to quit, it's hard to stop, and it is very addicting. And that's part of the quit line, is that it's no judgment here. We're providing support and things that are needed to help people to get on a healthier track.
Now, Dr. Hyland, I think that a major downfall in this entire situation is a lack of health education surrounding all smoking products. What do you feel needs to happen, or what do you feel needs to be prioritized so that kids, or just even adults, learn a little bit more about smoking in general?
Yeah, that's a great point. It's been more than 50 years since the Surgeon General's report came out and said that smoking was the cause of lung cancer. We still have 480,000 deaths in the U.S. every year attributable to cigarette smoking. And the products are just exploding, all different kinds of products. The slide that was showed the array of products that are people using. I think first and foremost is that cigarette smoking is incredibly harmful. And anything we can do to reduce cigarette smoking will yield tremendous benefits. And then the second component is looking at some of that marketing and how these products are promoted. And when it comes to vaping, there's even the FDA authorizations for the products that they have allowed. They've come with conditions that the products are not appealing to young people, that they're not advertised to young people, that former cigarette smokers aren't coming back to use these products. And so those kind of principles, where if there is a truly lower exposure product that cigarette smokers who are unable or unwilling to quit can be on the market, that it's done in a way that doesn't attract kids. And that's the needle that the FDA is trying to thread. But first and foremost, cigarette smoking is incredibly harmful. The New York State Smokers Quitline is a free resource to everyone in New York, 1-866-NY-QUITS. You can go to the website, you can Google us, and there's strategies and tips and free nicotine replacement therapy and FDA-approved medication to help people quit.
All right. Thank you both so much for joining us. We really appreciate it.
Thank you.
Thank you very much.
We'll be right back with more Open BxRx Tuesday.